day. My name is Zelda Theophilus Riordan, and I'm a proud member of the Alliance of Orthopedic Executives serving on the Advocacy Committee. Today, I would like to address the significant challenges that the 2025 tariffs pose to the U.S. healthcare industry and explore what we, as healthcare executives, can do to respond proactively. The impact of these tariffs is far-reaching. Healthcare systems across the country rely heavily on global supply chains for medical devices and IT systems. With most of these products sourced internationally, tariffs threaten to increase costs dramatically. Hospitals and clinics import the majority of their medical devices and supplies. New tariffs will raise prices on essentials ranging from syringes to MRI machines. Industry analysts warn that the prices for instruments such as catheters, diagnostic tools, and PPE will rise significantly due to import taxes. A recent industry survey reveals that 88% of healthcare executives expect equipment costs to spike at least 18% by late 2025. 94% predict even steeper increases, 33% plus for devices sourced from China or the EU. There will be cost shifting to patients and insurers with few alternatives, as healthcare providers must absorb or pass on these new costs. And 90% of hospital finance leaders report plans to shift costs to insurers or patients through increased charges. A Black Book survey found nearly all executives agree that patients or insurers will bear the financial burden. So, the impact on medical device manufacturers like Johnson & Johnson anticipate hundreds of millions in tariff-related losses. Trade groups warn these taxes may stifle innovation and increase healthcare costs. The tariffs also affect vital IT infrastructure. Imports of data center equipment, storage arrays, and telecom hardware now face higher taxes. This raises costs for server rooms, for routers, for diagnostic machines that rely on on-premise hardware. Consequences of this results in delayed or scaled back IT projects, greater reliance on cloud services which are not taxed, elevated risk to compliance and security due to prolonged use of outdated systems. There's definitely going to be a strain on hospital and clinic finances. As you know, as clinics, we operate on slim margins. Fitch Ratings warn that we won't have a cushion to absorb these significant excess supply costs. 75% of hospital CFOs are shifting expenses to patients or payers. Many are reducing technology, delaying construction, freezing hiring, or cutting staff. For example, Providence Healthcare in Washington, the state, estimate tariffs could cost 10 to 15 million annually, leading to difficult trade-offs between patient services and technological upgrades. There's going to be delays in innovation and modernization. 94% of healthcare providers are freezing EHR and AI project upgrades due to tariff-related uncertainty. This stifles progress and puts hospitals and clinics at a disadvantage in adapting to the future of care. Provider advocacy and legislative outreach organizations like the American Hospital Association are currently lobbying for tariff exemptions on medical supplies to protect care, quality, and accessibility. Now, there's going to be a disproportionate impact on smaller providers and smaller healthcare facilities with limited reserves. we're going to be particularly vulnerable. Some may reduce services, some may merge or close altogether, limiting healthcare access in underserved areas. Health insurers are reacting to rising provider costs by increasing premiums. For example, in Oregon, United Healthcare projects a 2.2% premium hike in 2026. In Maryland, Optimum Choice is going to raise premiums by 2.4%. In New York, there's going to be increases of 2.9 and 3.6%. That's been announced by major providers. More states are expected to follow suit as costs ripple through the system. Now, what can we do as clinical practices to advocate? Clinical practices play a vital role in protecting healthcare access and affordability. Here are some steps you can take to advocate effectively. Firstly, engage your policymakers. Contact your local and federal representatives to express concerns about the tariffs and their impact on care and affordability. Share specific examples of how your practice is affected. Join advocacy campaigns. Participate in coordinated efforts led by associations such as the American Hospital Association and the Alliance of Orthopedic Executives. Amplify your voice through joint letters, social media campaigns, and public comment periods. Educate your patients and communities. Raise awareness among your patients about how these tariffs affect care and costs. Educated committees can help influence public opinion and policy. Contribute data and testimony. Provide feedback, surveys, or direct testimonies to advocacy groups, government agencies, and media outlets that are documenting the impact of tariffs. Collaborate with industry partners. Work with suppliers, device manufacturers, and IT vendors to track costs, increases, and find alternatives sourcing or cost-sharing solutions where possible. Promote smart resource management. Internally, identify areas where cost savings can be achieved without compromising patient care. Efficient use of existing resources strengthens your advocacy with tangible evidence. Now, while tariffs were intended to protect domestic industries, their unintended consequences for healthcare are severe. From supply chain disruptions to rising patient costs and insurance premiums, the impact is systemic. We urge policymakers to consider targeted exemptions and solutions that safeguard the accessibility, quality, and affordability of American healthcare. So collaboration between providers, payers, manufacturers, and legislators is essential to ensure that economic policy does not compromise public health. I urge you to get involved today.